Good evening, everyone. Thank you for coming. It's really exciting to see this space being used and also encouraging to see so many people engaging. So really excited that you're here. Thank you for coming out. I know the weather didn't really cooperate with us, but that's okay. We're dry in here. And so really just thankful for that and also for this lovely space. And just really excited to bring this panel together for you tonight and share a little bit about our resources here in Forsyth County. But before we get started, I just want to recognize a few of the people that we have here in the audience. First, on the very back row, I see Commissioner Dan Bessie, who showed with us tonight. So thank you, Commissioner Bessie. I thought I was going to miss him back there. I was scanning the audience, so glad to see him back there. Commissioner Gray Wilson, thank you, sir, for being here as well. We also have on the front row here Chantel Robinson. She's our county manager, so thank you. We have one of our deputy county managers here as well, Denise Price. And I also would be remiss if I did not point out Mr. Andy Hagler. Andy has been very instrumental in putting this together for us tonight. He might have thought he was going to slip by, but Andy, thank you. He did a lot of the planning, a lot of the prep work, a lot of the emailing and putting things together. So Andy, thank you. I would be remiss if I didn't shout out to you as well. So I wanted to send a special thank you to you. And as we get ready to go tonight, I am Michael Duncan, Behavioral Health Services Director here with Forsyth County. I am wanting to welcome you here. Really excited to also welcome the panel. Tonight, we have Brent Motsinger right beside me. He is with our
Mobile Integrated Healthcare Department.
All right. Beside of him, Kristin, go ahead.
I'm Kristin Ryan from the B.E.A.R team with the Behavioral Evaluation and Response team.
All right. Ashley.
Yeah, I'm Ashley Golds from Daymark. I'm the Senior Director over our Crisis Services.
And Marti.
Hi, my name is Marti Webb, and I am the Program Manager at the FBC, which will be opening shortly.
All right. And we're going to try our best not to use any acronyms tonight. So
Facility-based crisis.
And that's going to be hard for us because we're all used to using acronyms. So if we catch it, we're going to not use them. But if we don't, feel free to raise your hand and we'll try our best not to. All right. And we're going to try to do some really good keeping our microphones up so that we can make sure everybody hears us good. So if you cannot hear us and you're in the back of the room, again, please feel free to raise your hand, flag at us, or something like that, because we want to make sure you're really getting these resources and make sure that you can hear us really good tonight as well. All right, so with that being said, tonight's really about crisis responses for behavioral health, and we want to make sure that we are being here to deliver information to you, and that we're just telling you some of the things that we have with our partners here in the county. By no means is this an exhaustive list of what we have going on in the county, but it is some of the things that we have. So we want to make sure that we are giving you information. There's plenty of other partners. Some of them are here in the audience with you tonight. Some of them could not join us, but we do want to highlight some of the ones that we have on the panel tonight and let them tell you a little bit about the services that they offer. And then give you an opportunity to ask questions and let them provide those answers to you. Some things we might have answers for you tonight, some things we might not, and that's okay. The main thing is we want to create dialogue and just make sure that we have those conversations and provide some answers to you. So I'm going to kick it off with a couple of questions, and then we're going to open it up in just a little bit for your questions as well. All right, Ashley, I'm coming to you first.
Okay.
So can you tell me what is at Daymark, all right, this is specific to you, what is a behavioral health urgent care?
So I'm going to use a little acronym and explain. We call it the B.E.A.R, so some of you might hear that it's a B.E.A.R. It is a Behavioral Health Urgent Care. So what a B.E.A.R does is it takes your normal Monday through Friday 8 to 5 services and it opens it up so that you can come in 24/7. First and foremost, you come in, you can get an assessment, and then of course get recommended services. From there, you can also come into our 23-hour chair. Our chair is an observation facility, and typically the folks that come in are looking for inpatient services Or maybe something happened at home and they need a safe place to be for a little while. So they stay with us and we can refer them out to other services if we need to.
Thank you very much for that. I will let you know that if you keep the microphone a little closer to you, they don't have to turn the volume up quite so bad, and I think that's where the feedback's coming from. All right. So let's go on to Brent. Let's start with you next. For those who may be hearing about mobile integrated health for the first time, which I imagine some people might be, how would you describe that program to the community?
So first and foremost, mobile integrated health is one of the greatest things I have ever been a part of. And I'm one of those people who likes to challenge the norms and to take paramedics who typically respond to 911 calls and really tailor them in their training and a lot of what they traditionally do and have them focus it towards responding out to individuals who are in behavioral health crisis or who are going through substance use issues. That would normally just get a 911 call and say, let's go straight to the hospital. Which hospital, Baptist or Forsyth? And typically in our community, that's been your two choices. Now we have the ability to take those paramedics and have them screen those individuals, and we can see, medically, are they stable? And then do they qualify to go to alternate destinations like Daymark or other community-based services here in the county? So having that medical knowledge and that ability to really transition people who are in crisis, because as someone smartly told me today, when you're going through a lot of trauma and a lot of crisis, it's probably not great to be around everybody else going through theirs at the same time. So the emergency department may not be the best place for you. So to be able to take those individuals and connect them to resources that really are tailored to their specific needs and helps address whatever specific crisis that they're in has really been beneficial. So as mobile integrated health paramedics, and we also have a peer support specialist, and her name is Kantisha, and she's amazing. One of the greatest parts of that program is that we see them a lot of the times in the field, or we get a referral from other providers or somebody who's in crisis. We're able to kind of connect that resource, and then with the peer, we're able to maintain that connection. So we keep them engaged, we do the follow-up, and we're able to kind of keep keep them focused on the goals and the things that they want to accomplish, whether it be sobriety or maintaining their medication compliance or getting housing or all those other things that contribute to them not really being able to focus on their own care.
Awesome, thank you. Okay, Marti with RHA. And for everybody that's out there that says you wasn't going to use acronyms, RHA really is RHA. So, so I didn't break my own rule, just so you know. All right. What services does your team currently provide, and who is your primary population?
So currently, we're waiting for our doors to open. We're waiting for the state to say, okay, you can open. But when we do open, we will be a facility-based crisis, or FBC, which is a 24/7, closer, oh, that's better. Okay. A 24/7 non-hospital 16-bed facility. It's dedicated to providing mental health stabilization as well as detoxification from substances. Our primary, this is really bad. What am I doing wrong?
I don't think it's you.
Oh, okay. Our primary populations are individuals in the community that are experiencing behavioral health crisis, including withdrawal management from substances or need some mental health stabilization from a mental health crisis. We serve folks that typically are underserved and experience barriers to other levels of care.
Terrific, thank you. All right, Kristin, you're up. So, question that I've heard recently is, do you serve people outside of the city limits?
So our program is housed within the Winston-Salem Fire Department, and we are a City of Winston-Salem program. We do assist if there are some concerns or things right on those borders, but most of our responses are within the city of Winston-Salem.
Thank you for that. All right. Let me check on time. We have some time here, so I'm going to go one more round with everyone. Ashley, she's like, I knew that was coming. All right. So does a behavioral health urgent care have any exclusionary criteria?
We try to limit the exclusionary criteria, but the main things, because we are an extension of outpatient, we do not have medical services. So if somebody has a major medical concern, then we might have to seek other services. And then if somebody's really aggressive, then they're not able to come in with us. But pretty much anybody else, we try to serve as much as possible. And if somebody does show up and we feel like, this might not be the best service for you, because we want to keep everybody safe, we'll reach out to others. We don't just turn you away at the door. We'll provide that transportation somewhere if we need to. So we try to do everything we can to link you to other resources.
Thank you. All right, Brent, here we go. What inspired you to take on this kind of work, and what keeps you going on those hard days?
So believe it or not, like I said, I've been a paramedic with Forsyth County almost 20 years. I'm born and raised right here in Forsyth County. I only lived about 10 years away when I was in the military. I have had personal experience with a lot of veterans and their issues. I also have family histories of people dealing with crisis and substance use. And so it was just one of those things that just came naturally to me. And as I have found through my search to hire paramedics and everything else, there is, there's a need. And there's a lot of people who have lived experience and who have family members with, with histories that have dealt with substance use and a lot of other crises. But you really got to find those good paramedics that love it. So, and when you do, you really just get a passion for the work. And what really keeps me going on the days that, sometimes it seems like, man, I just need a win today, is every now and again you do get that win. And those wins, when you're working with people who are going through behavioral health issues or crisis or substance use, when you get a win in that specific population, it's not just one win, because it's a trickle-down win. So if you help a mom who's going through these things, then their children benefit. If you help, someone who needs a job, now you've helped that employment. Or if you help, it's really a community benefit when you help someone really find a success when they're on their behavioral health and substance use journeys.
All right, thank you. Marti, back to you. How do clients typically access your services? Once you get open, do you think it'll be referral, walk-in, court mandated? What typically is your referral base?
So there are several ways to access the facility-based crisis, the FBC. We get referrals from other community organizations and healthcare providers, as well as crisis hotlines. But more importantly, in an effort to keep barriers as low as possible and to have an open door policy, we encourage walk-ins, because when someone's ready for that help, we want to be able to help them.
All right, thank you. Kristin. So you already answered part of this question, but we know that you're housed within the city under the fire department, but what are your hours of operation?
We're 24/7. We have a full staff of 10, and they team up, and we have 24/7 coverage. And we also will make sure that if anybody has special needs or things like that, that we will accommodate extra transports and things like that. So we do our best to go above and beyond of what the client care is.
All right, that's amazing. So I'm going to ask a couple of my staff members to come up, if you will, please. We're going to open it up to the audience for some question and answer. We will be sharing our microphones up here, but feel free to address your questions to whichever program you'd like to get a little information from. And they're going to walk up and down the aisles and open it up, so feel free to raise your hand or stand or sit, whichever is more comfortable to you. And with that being said, the floor is going to be yours.
I can comment on that. When we developed our team, we created a multi-party release of information. And it has every agency that I knew of then, and obviously, you know, as things grow, we'll make sure that that's updated. So if we kind of get together and whoever sees them first, make sure that they sign those releases, and the releases are meeting the standards for both substance use and mental health, which are different. If we, maybe that would be an effort we could do, is making sure that we're really utilizing that multi-party release to its full potential, and making sure that's available to all the providers is a way we could do that.
And I will say the same thing. We have that, we call it our consent form, but we have all of the providers listed on those things. And that's one of the biggest goals that we have, is to be able to break down any barriers and really share information. From the medical side of things, we built that consent form in terms of HIPAA. So if you guys have ever heard the HIPAA laws and things like that. So to be able to share information medically, it really relates the same way that it would in the behavioral health, in behavioral health and social situations. So we ran it through the county attorney. He approved it, so I know that we're good there. And I think I've shared. Do you have that? Yeah, I think that's pretty much the same form. So we'll do our best to make sure we get those things filled out.
If Ashley, can you share a little bit about mobile crisis? Okay. And then again with mobile crisis, because then you got mobile crisis, B.E.A.R, and the mobile integrated health, kind of taken with what Leah was saying. How do y'all all work together and coordinate to try to reach those, especially through like a mobile crisis type service at the most expedient time?
Mobile Crisis is a service that can actually come out into the community. So through Daymark, you can call a dispatch line. At that dispatch line, they'll take your information. It can be the client, it can be a parent, it can be partners, anyone that wants to call, and we'll take that information, and then we will go out in the community to see them. With that, we also can do basic engagement as well. The state calls it mobile crisis. We actually call our team mobile engagement because we want to make sure that somebody doesn't feel like they have to be in crisis in order to get the services. Essentially, if you are in crisis, it is totally what your crisis is. We don't judge that, and we will come out to your home, to the community, to a school, wherever you need us to.
Well, I will say this, that's a great question, Andy, and I think myself working not only with the community and different service providers, but also with this team is something that we've had to navigate a lot. So in my experience, the behavioral health world is just like the medical world. You have different specialties and different abilities, and there are always different laws and regulations that tell you what you can and can't do. Luckily, we talk to one another. So I utilize the B.E.A.R. Say I was on a 911 call and somebody was absolutely adamant that they wanted to talk to a professional, but they did not want to leave their home. So that opens up mobile crisis for me to call and engage them. It also opens up the B.E.A.R team for me to utilize them to be engaged with. And say, you know, I'm with somebody who says, you know, I really want to go inpatient, but I want to go to the VA in Salisbury. Well, there's a B.E.A.R team member that may be able to do that transportation where I, as a paramedic, may not be able to leave the county limits. Or, you know, if I'm driving a quick response vehicle, I'm not allowed to transport somebody to the hospital who's not in an ambulance. But Kristin can definitely, and her team can utilize that. So the team here should be able to talk amongst ourselves and really work together to try to find whatever route that it takes to help that person connect to the service level they need.
Well, and I'll say one thing I love about this team, and we're excited for RHA to join us, is that if we have a difficult case and we are stuck and it's like, what do I do with this person? We need to help them. I'll get on the phone with Brent and I'll be like, hey, let me kind of walk through this scenario. What do you think? He's done it the same way, Kristin. So that's one thing that I love, that we can call each other and say, okay, hey, what can we do? Because we still want to help, of course.
And I can just echo that this group here and all the providers in the county, that we do communicate quite frequently at the best interest of our clients. So there isn't barriers. maybe there's some perceived ones, because when an individual goes into one door, they may get some conflicting answers, but when they connect with one of us, we do help them through all of the processes that they need to get to, and make sure that they are connected to the appropriate level of care, the right level of service. We do really work hard for any individuals that we engage with.
So, I know that the B.E.A.R has a 23-hour chair, and that's the format. What timeframes does the new facility-based services carry?
The facility-based crisis will be between 3 and 7 days, typically.
Thank you.
Hi. I wanted to help us think about how right now we're in a time there's a lot of emotional and mental distress that may not be clinical. I've been told by both Novant and Atrium clinicians that more than half the people that show up in the EDs are not in need of inpatient care. And so I'm curious about what kind of resources you utilize for people you come into who are in distress, but whom you assess not to need clinical care, because it's a real setback for someone who thinks they're going to go get help through the ED, and I realize not enough people know about these other resources. But to meet with rejection at that point can be really, really hard, and it can be at 3 in the morning, and they're just, maybe they're given taxi fares, and maybe they're not. But they're not allowed to stay in the EDs typically, so they have to walk back out in the streets in distress. So I'm just curious about how y'all relate with folks that you can see are really in distress, but you kind of see what the stressor and the trigger is, and how you follow through with those to help those get support. Thanks.
I think I can answer for kind of all of us. We will come to them. So if they need anything and they feel like, hey, you know, I can't get this through an ED, we truly, honestly don't want them to have to go through an ED. We want them to walk into like a B.E.A.R and hopefully come to RHA for services. So we will meet them where they are. I think it's also getting the word out so they know. And we talk to some of the EDs and give them information about our services. So hopefully we can continue to support that.
And I'm going to say, we use you, the peer support group, Green Tree. We do try to find every avenue that's most appropriate for the client. So we do appreciate the services that you offer with Green Tree. We also really look out for family resources, natural resources that the individuals had before. We do our best not to jump to any kind of inpatient or high level of care. A lot of things can be resolved with assistance with follow through and outpatient and things like that. And we have the ability, once we address a crisis, we have the ability to do continuous follow-through and follow-up visits and transportation, and try to break down any of the barriers that the individual has to accessing the outpatient level. So we do really work hard at that and try to utilize the EDs as a last, and even Daymark as a last resort.
Yeah, I also want to add to that. Thank you, Lori, for bringing that up. We also rely on our vendors and our partners out in the community as Forsyth County. And so it's very important that we have those relationships with all of our partners, because they do carry through with their services. And so we do quarterly meetings with those individuals to make sure that we are communicating with them and we're getting what the needs are. And so that's how we learn about these issues, and we learn about these things so that we can address those and bring those issues up. So very excited to partner with them and see where these gaps are and how we can better adjust to that. So that's really important that we get that feedback. Yeah.
Hello. We know AI is a trending topic in every organization to be innovative. How are you using AI, and what type of technology are you using to diagnose mental health when you get on site, and what do you plan on using in the future?
Well, I can say I actually do a lot of the data around a lot of what EMS runs. I haven't utilized AI yet, but I received a phone call a couple of weeks ago from the company that runs that software that they are looking to add maybe an AI feature that would allow us to automate some of that data pool. Other than just talking with them about that, that's about as far as we've gone. As far as our abilities in the field, One of the greatest things that we do is we can do televisits. You know, we can connect people with Daymark or HA or whoever else their provider is, and we can get that provider on the phone, and we can do a telemedicine visit or a telepsych visit and allow them to get, that contact right then and there. And we still currently, we're all advanced life support paramedics. So we have monitors and AEDs, and I mean, if while we're out there an earthquake happens, we can shift gears and go that way if we need to. So, but that's what our capabilities are in the field.
I'd like to get down to the nitty-gritty, which affects all of you, and that's a matter of funding. Do you get funding directly from the city, or is it primarily with grants? And with the possibility of a lot of budget cuts, do you see that funding possibly going away? How stable is your funding at this point?
So I will say that right now we are very fortunate that Forsyth County does put aside money, and they do believe in behavioral health services. Our commissioners are here tonight, our county manager, deputy county manager. We are very fortunate to have our leadership here. We are very fortunate also that they very much believe in behavioral health services, and that they do believe in the services that we provide and the funding that they give us. We are among the top counties, so we are very glad for that. We also have the opioid settlement funding, which comes through. That's not going away anytime soon, so we're going to be able to continue funding our partners in the community. Anything can happen in the future, as we all know, right? Funding is funding. But as at this time, I don't foresee that any of the services are going to go away, and we're going to continue to try to meet the needs of the community. So we are funded by the county for a majority of our services, but also that opioid settlement, which comes from funding from the government, federal government level. So Kristin, you can talk about Winston-Salem Fire Department, because that's where you're funded through.
We received the opiate settlement funds that were drawn through the city of Winston. And then we also received an expansion grant through the Department of Justice to expand our team from 6 crisis counselors to 10 this last year. And that also allowed us to do some more marketing and awareness events, things too. We're on our 2nd year, so we're kind of new. We're trying to make sure people are aware of us. Our funding is relying on grants at this point. We're not county affiliated. We're within the city grant. So I'm always seeking other opportunities and things like that. And we did get fortunate to get the Department of Justice grants. And there's other things that are available for our field within mental health and substance use. So our team will continue to search out additional funding that way, but we are strongly supported by the city and will be backed should any instance, they would like us to stay, from what I'm told.
And I can say for us, the 2 major ones are the county provides funding, and then partners, who I know there's some partners people in here.
Hey Brent, nice to see you again. Can community members specifically reach out to you to respond to a crisis? Example, I had a neighbor that had a mental health crisis recently, and well, I've been in mental health a long time. They really could have used somebody that specifically works with the mental health population rather than just a regular EMS show up. Can you call and say, hey, I'd like an integrated response team to show up to this crisis because this is what's going on?
Yes, short answer. So our hours right now are kind of Monday through Friday, 8 to 5. We're working on growing the program. Like I said, when you're looking for paramedics with a lot of passion for behavioral health experience, sometimes that's a little few and far between. But yes, if our office number is 703-2273. So if you want to feel free to reach out, and one of us should be in the office, and if not, we check the messages pretty frequently. If not, if you call 911 in that comm center and say, hey, I would like an M.I.H paramedic to come too, then that 911 center, as long as we're on duty, can set off my radio wherever I am, and then I'll call them and say, what's going on? And they can send me your way.
Good afternoon. I'm Dr. Michelle Myers, and I have a question that goes back to the funding. You all cited the source of where your funding comes from, but I'm interested to know that is the funding adequate? Do you have enough staff, resources, so that you can make sure that people who are in crisis get the services that they need in the time that they need that, So if anyone and all of you can speak to that, please.
So I will say that from my standpoint, the funding that this program has received has been adequate. I think one of the coolest things about funding in itself, for me, is that being kind of the boots on the ground people, that we see where services and funding are needed more than most. And we have a great pathway and a voice now to relay that to those service providers and to the county managers who, kind of can help us make a better decision based on what we see as the public's need and what our patients communicate to us. When they say, hey, look, we need more housing services or crisis services or food banks, whatever else it is, those barriers that we run into, those clients and patients let us know. So then we can kind of help steer those conversations when funding is needed towards those resources that they have asked for themselves.
And I will personally say that coming from the federal level to the county level, I am very impressed by the commitment at our county level here in Forsyth County with the funding, with the resources. I think our biggest hurdle with M.I.H has been literally finding the people to fill the positions, not the funding itself. So, if I had anything, it would be just finding the people to fill the positions that we already have the funding for. And so it's not the funding itself, because I think the funding is great. I think it's finding the people that actually qualified and filling those positions.
And for us, and like I said, we were very fortunate to get the Department of Justice grants to adequately staff our team. Now we're at 10 crisis counselors, and we were able to get adequate vehicles and supplies. So at this stage, we are very adequately funded. We're in 10 crisis counselors, does meet the need of the community right now. We're about 200 calls per month within community events and other things. We're doing really well right now. We are going to, like I said, cycles and funding stages do change, so we are going to continue to make sure that we're able to maintain that. But currently, we are sitting in a really good position for this year, and we were able to really make the team strong with the funding that we were given.
And I'll say for Daymark, it's a little different because we do bill insurance and things like that. But whenever we're looking at a new program or feeling like we need to expand something, I can tell you for Forsyth, we go to our county and we say, hey, this is kind of what we need. We create that budget, and they've been really good about making sure that we have what we need to keep going.
I just wanted to ask, I guess Daymark, but anyone, with the changes that are coming for Medicaid, do you feel like, are there going to be any changes to your model? You said that you build insurance, so what happens, I guess, when you don't have any?
Yeah, so it definitely falls back on some of our funders, like Partners. Partners is one that allows us for our crisis services, so mobile crisis, the B.E.A.R, Behavioral Health Urgent Care. It's free, so it's pay or blind. So if we can bill an insurance, sure, we'll bill an insurance. But Partners is a huge part of making sure that anybody that comes in, we can see them, whether you have insurance, if you don't have insurance, even if you are from California and you are visiting a family member and you need to come see us, they're able to provide that.
I was wondering if there are any safe places in Forsyth County where addicts can go to be watched over while they're using, and a lot of addicts have problems. Plus, it would help remove the stigma associated with being an addict.
So, hi, I'm Denise. I'm not on the panel, but I can see that in Forsyth County, we do not have safe. Thank you. What we do have is a very active, full-time funded syringe service program, Twin City Harm Reduction Collective, who does distribute safe use supplies. They are in the Green Street Church. They also have mobile services. So if you have access to the internet, just search Twin City Harm Reduction Collective. Their webpage will show up. Their phone number's there. If folks can't make it to their site, they will come to you. And when you leave here across the street, we have the Highland Avenue Center. They also have a syringe collection kiosk there, as well as on Broad Street where they will collect used needles. And it doesn't have to be from illicit use. If you have diabetic supplies or anything else, they'll take that as well.
Hi. I wanted to ask if I know we've had lots of experiences, well, as advocates years ago when we were advocating and we finally had a B.E.A.R open. What people thought that was a behavioral health urgent care setting. But what they found is you take a person, they may get an assessment which kind of looks at eligibility and other things, but they may not be evaluated. They'll be given an appointment for an evaluation that may be several days later. Well, that's a little bit too late when you're in a crisis. So I don't know if that's something that, because the funding structure, we're stuck with that, or if there really is a way that people can get urgent care when it's urgently needed through that model, because right now there seem to be a lot of barriers between the time people go through that process of assessment and they actually can sit down with somebody for clinical care. So if anybody can ask that. It may not be a model issue, maybe a funding issue from Medicaid and the state, I don't know, but we've all been disappointed because we really thought people would walk in and get clinical care. I realize there's a shortage of psychiatrists and other clinicians across the country, but we just kind of curious about what goes on with all that. Thanks.
Yeah, I have the behavioral health urgent care, so I can answer. We actually do have a provider that works with us Monday through Friday, and we access her. So if there is somebody that truly needs that service, they need medication management, we can get them set up with her. We also have a couple other providers that we can work with as well. So if you ever feel, and I'll just put this out there for anybody, if you ever feel like you are not getting the care that somebody deserves, you are welcome to call me at any time. I know Denise will say, I will answer at 2 a.m. because if that's when you have the crisis and you feel like you're not getting something, then we want to answer that. You can't say, hey, can you press pause for a minute, and we'll answer it at 8 a.m. in the morning. So please, we always open up. My cards are back at the Daymark table, and you can talk with me after as well. But if you feel like somebody is not getting the services that they need, then absolutely give me a call. We will make sure that they get what they need.
Hi, I'm Michelle Davis, and Ashley is correct. She will answer a call. I've had situations, and we've had to turn to you quite a bit. But to that point, that's a good segue into part of my question. Do either of your programs have a CBT or a cognitive behavior therapy attached? Because I've found and have been living for months in a perpetual cycle of improper care for a loved one. And I don't know if anybody else, but it goes to the question Lori had mentioned earlier. The services, your models sound perfect until in crisis, when the persons that are responsible to implement them don't necessarily carry it through. What do you have in place, or is there anything that can be put in place to put cognitive behavior therapy into the structure along? Because the first thing everybody says is medication. But if you're medicating somebody that's in pain and in crisis, you're pushing more pressure into the subject, and it doesn't seem to be meeting the needs long term. So I don't know if that was a question, statement, or all of the above. But
Again, I can speak for Daymark. When somebody comes in, it is evaluating what all do you need at that time. Some folks come in and they know exactly what they need. They need detox, or they need mental health stabilization, so we get them to those facilities. We also have our staff that are there to walk them through things. If they have a crisis plan, we'll talk about that. We can also get them into extended services through outpatient. So as long as the client is willing to talk with us and kind of sit down and really develop kind of what they need, we are able to do that. So going through outpatient also. But yeah, we will sit there with them. There's many a nights where I'll get a phone call and they'll say, hey, this is kind of going on. What do I need to do? Because at all times within a behavioral health urgent care, you always have an admin on call. That person is licensed. I am one of them. And so they can brainstorm ideas and say, okay, this is kind of what's going on. What do you think I need to do? So they always have that backup. And truly, a behavioral health urgent care is an observation unit. So we do want to figure out what we can do to get them down from that crisis so then they can continue to do other services.
Me again. You said everyone can come and get services at Daymark. What is the status of undocumented? Because I've met a lot of people in the hospital saying that they couldn't get services or they would have to pay for it.
Yeah, as far as a behavioral health urgent care, you do not have to have a social security number. You don't have to be
No,
documented.
Regular Daymark.
Yeah, regular Daymark, so it's a little different. We do have to have some insurance or a social security number. Of course, you don't technically have to have insurance, but yeah, we do try to provide to other services in the area. If they are undocumented, they would have to pay.
Other services for them.
Are there other services in the community? Yes, there are.
Hey, I'm Wendy Broadstreet. I am a retired middle school teacher, and I am currently a grad student at North Carolina A&T in clinical mental health counseling. And I have a question about our kids. Do you see children and teens in crisis? And where do they go for help?
Okay, so as far as kids, they can come in. We typically take age 3 and older. We say 3, 4. But they can come in if they need to stay with us for a little while. It is absolutely up to that family if they'd like to stay with us. But of course, we can provide the normal services of if they need mobile crisis to come to them in the school. We can go out to them or meet them in their home. But then we can also provide those outpatient services as well.
Yeah, and we kind of do the same thing. It's usually a response. It's not age-based, and we will engage. We'll do a lot with the families on scene. A lot of pediatrics that I have dealt with really and truly already have services, or they just need a little bit of help engaging in those services during crisis. Sometimes there's law enforcement involved. Sometimes there's lots of other providers involved, and being able to help the family navigate those services and connect to places like Daymark. Maybe the child needs a little place to de-escalate, or the mom needs a little support, that we can connect them to different services. So it's really kind of when you're working with children, you kind of work with the whole family. So that's our approach to it. But yes, there are a lot of services, even in the emergency departments, the Brenner's ED and things like that. They have specific psych providers that can come down and speak to any patients 24 hours a day, 7 days a week.
I can kind of say the same, that if we come out and there's any children or teens and stuff like that, we do really work with the whole family, and a lot of times they are connected to certain things, and it may just be that engagement piece that is needed for the children, or that encouragement, and we have that ability to safely transport. We do require the parents to ride with us, but sometimes we try to make it as less invasive as possible if we're able to.
And I'll just reiterate, we have 4 of our vendors or partners up here. But keep in mind, Forsyth County, we have a lot of partners that we work with and help to fund. So, there's, I believe, 26 different grants that we send out for this fiscal year. So this is just 4 of those partners. So keep in mind, if you have questions like that, please reach out to us. Find us on the internet, find us on our county pages, and we're more than happy to help you get plugged into those resources as well. Partners, which you keep hearing, they're here tonight as well, so they have a lot of resources as well, but we have a lot of good vendors and good partners in the community that we're more than happy to help you connect to.
So it seems like we're lacking a bit in dual diagnosis. I know that boots on the ground, at least 3 and hopefully 4, you all handle severe persistent mental illness combined with wicked substance use disorder, active at that moment, and physical congestive heart failure and all that. I've seen all of you all do that. How does that person with the trifecta of issues Because it seems like when we're doing research, we can find someone, we can find a facility, but they can't take them because of the mental health for their substance use disorder, or can't take them for the substance, and how are we, am I wrong about, I hope I'm wrong about that.
Well, I can answer. We just had a client that was very similar to that. It had a lot of coexisting. So sometimes you have to start with what's the primary issue. We had one that was on dialysis, so you can't go into rehab while you're active, like trying to find those services that will address all of those issues are tricky. The best way we've been able to handle that is get them through the dialysis treatment, then drive them to the thing. Like that follow-up piece that we do probably is the only way we've been able to really assist a person with multiple issues, because sometimes they need to detox before they can get the mental health treatment, So we do try to follow and do a lot of the follow-ups that way and take them, and it's an assessment of, okay, what's step one, what's step two. But you're right, it is very difficult for any one provider to sometimes address all of those things, and not to their fault. It's just, it is, and we want to make sure that a person's safe. So we know if, they're highly intoxicated, we don't want to take them over to Daymark until they're safe to be at Daymark. And, we do a lot of assessment that way, but it does take a lot of work as far as keeping the person safe and keeping them engaged to go to those next steps. Sometimes they'll address some of those first steps and be like, oh, I'm fine now, but keeping them engaged and encouraged to take those the next treatment steps, because it can be cumbersome for them as well. But we do our best on that, but it is definitely a challenge.
And I'll say from our standpoint, that's probably what we see most, to tell you the truth. I think a lot of what we do by engaging different services and having us all work together, because those clients, you didn't wake up one day and all of a sudden, you became schizophrenic, and you also developed congestive heart failure, and now you have an addiction issue which you're doing to self-medicate because of your other issues. And it's just one of those things that naturally occur, and being able to manage those clients, being able to do what Kristin said, and really work with different providers like our hospital systems or primary care offices that have, like the primary care at Highland Avenue that's seeing clients now, they're seeing patients now, to be able to engage them and say, hey, you're right across from Daymark. So we've got primary care physicians doing your medical. We've got Daymark right here who's working with your behavioral issues. And we have the pharmacy right here that can get your prescription and keep you on track, while you're also working with M.I.H or B.E.A.R or Daymark in the community with supports like ACT teams or, community support teams to really keep you on that track while you're going. And that's one of the greatest things we can do, is kind of advocate for all those services at once. And when you kind of have that repository person, whether it's M.I.H or B.E.A.R or Daymark or whoever it is, to have that advocate that says, hey, look, I'm aware of the medical, the behavioral, and any other social issues that are going on. So when it all falls apart, and it inevitably will at some point in time, call me. We can come out, we can start rebuilding that plan that we initially did when we got there. When we met, we built a plan of care, and it's not just take your medicine. It's also, how do we get you better housing? How do we make sure you're receiving the benefits that you need? Do you have your Medicaid, your Medicare? Do you have food shortages? Do you have all these things that we can kind of build for you in this plan to connect you to what's hopefully a better quality of life?
This question is for anyone. I'm curious, what metrics do you use to measure success? And at what point do you begin to ensure that your services are meeting the evolving needs of the community?
So I'm going to start with that one. My measurement of success is right here in this room. Having all of you here, having this conversation, for me is a success, right? Because we're having this conversation. And so that is one measurement of success. Who would have thought a year ago, even 6 weeks ago, 2 months ago, that we would be in this space having this conversation? So I first want to thank you for having this conversation, being open to being here, and even being open to this dialogue. So that's success for me, right? Is it perfect? No, we know this, but we're having the conversations. We're bringing these ideas together. We're talking about that community of supporting one another and how do we build that. So that's success for me, right? And so the more we can talk about this, the more we can normalize, for lack of a better word, and talk about our wins, but also talk about the things that are maybe pain points. That's success, because we're moving that needle and we're talking about what we need to do to build a better society for all of Forsyth County. So that's success. That's how I measure. It's not necessarily about when we're getting to that perfect world, but it's how we're building it and how we're building that foundation and how we're moving that needle.
I would also say success is kind of depends on the client. So if the success is that they show up and they decide, you know what, this isn't for me, and they leave and then they come back, that's success for us. So I think it's really person-centered. It's not necessarily about always the data or the numbers. It's about meeting them where they are and saying, okay, what can we do to help you? And so if it means that they make it into RHA or they work with M.I.H, that's a success for us.
I kind of have the same kind of answer. It is very client-centered. So success isn't that the client did exactly what we wanted them to do, or that they followed our guidance. The success is that they're safe. I mean, that's always our first measurement. We go out to, very high risk crisis calls often, and our job is to make sure that they're safe. So sometimes it may be that they're not going to go to rehab or stop using, but they may reduce or harm reduction, or it may be that they've agreed to go to the doctor, at least have that conversation. So it is very client-centered, and it does look different for every individual. It may be that somebody agreed to at least go into a shelter one night when it's really hot out and that they're safer that night. So that's kind of, our measurement is very fluid as far as how that goes.
For RHA, the same as with the other team members, the success is a kind of multifaceted concept, but mainly it is how can we best support that person to reach their goal? And then key indicators of that would just be a better quality of life, but their better quality of life, not what I think for them. And so empowering people to be able to take that next step, no matter what that looks like, that's success.
And I will say from my perspective, it's a little bit different, but I echo the same patient-specific goals, and when we see those individuals succeed. But one of the coolest things I like to measure, and I see as a success, is when our teams kind of report off to the agencies that are serving our community and say, hey, we noticed a little bit of a barrier here, and we see that barrier get removed, and we see that patient engage in services again, and that service provider not just do one great thing for one person, but now the community gets to benefit from that experience. So when you see organizations that are in this room continue to grow and provide services, like Lee's organization as it grows, and all these other things that just continue to expand and grow, because as we all know, one of the biggest barriers, or one of the biggest things we hear from people, experiencing behavioral health issues is nobody cares. Or, I tried and then they told me to go away, or this didn't work, or nobody wants to help me. So when you see them really not have that response anymore, when they engaged with Daymark and somebody opened a door, or they went and somebody provided housing, you see those services start to work and the community start to really grow and those services expand. That's what I consider success.
I'm Jan Kelly with Samaritan Ministries, and I just appreciate all that you all do to help us in our work, and want to piggyback off of what Lee said at the beginning. The more we can get together in the same room with our guests and our neighbors to solve problems, the quicker we can get to some of those solutions, and we've seen it really work a number of times. But my question is for Ashley. What you mentioned that there were some major medical issues that excluded people from the B.E.A.R. What are those major medical issues?
Yeah, typically it might be something like somebody that is going through withdrawals, typically has a seizure. We want to make sure that they get the medical treatment they need while they're potentially going through withdrawal. It could also be a really high level of blood sugar. So you're looking at like the 3s, 400s. We get folks with that. Could also be blood pressure. So if it's really high, then we have to make sure that we don't have a stroke that might happen with that client. So it is kind of more of those major medical. We have sometimes we get folks that have open wounds. So we have to make sure that that medical side is treated first. And the way that we do that, we have a referral sheet, and we will put on that sheet exactly what we need from the hospital or wherever they choose to go. And we will call that place and we will say, okay, this person's coming. Or we will actually provide a warm handoff. So we will physically drive them to that emergency room or wherever they want to go. So that the effort is in there, and that we want them then to get that medical treatment that they need and then come right back. And so if that means we have to go pick them up, then we'll go pick them up, or we'll utilize mobile crisis. So those are kind of the major medical stuff that we can see.
I just wanted to ask a little bit more specifics about services to those who are undocumented. Are they equal, like the same regardless, or is there any distinction in terms of services provided for undocumented? And also what resources exist, and they may be different from among you in terms of dealing with people that English is not their first language. So how do you deal with people that don't speak English, not just Spanish, but other languages that may not be common here?
Yeah, I can speak to that. Within our crisis services, undocumented, social, anything, doesn't matter, pay or blind, so you can have insurance or not, we will provide them services. So a B.E.A.R, mobile crisis. When it does come to outpatient, we do refer out, unless they truly want to come to us and they pay a fee for that. But yeah, we can provide any services as far as the crisis services. I know there's other services in the community that also provide services, so we might have to refer out. Yeah, we have an interpretation line. If it is Spanish, we do actually have quite a few clinicians that can work with them, but if it's a different language that maybe we don't have, or ASL, we have an interpretation line that we work with, and we can either see them right there, or we can actually schedule it so that they get what they need.
And I can speak to that as well, because we do help to navigate that quite a bit. If you have an individual that is struggling with getting services, you can call the B.E.A.R team. We do have, and they're actually in the audience now, we do have 2 Spanish-speaking crisis counselors, and they will help to navigate with the services that are at their level of care, and will help to assist them with whatever needs that they have. We can help to bridge some of those gaps. We can help them walk through some of those services. And we do partner with other agencies too that can help them with their health needs and things like that. So if there is a question or a concern of how to help an individual, you can call the B.E.A.R team, and we can help to navigate them through those systems.
And we're going to take about 3 more questions, and then we're going to have to wrap it up for the evening. So 3 more.
Good evening. I'd like to give a compliment / testimony, and then I'd like to ask a couple of questions, please. First, I think access leads to success. In particular, Andy, and I never know if it's Hagler or Hagler, but he's Superman to me, the executive director, had a family member that was in crisis, a mental health crisis. I stumbled upon someone who referred me to Andy. About an hour and a half to 2 hours later, he had equipped me with compassion, legal recourse, conversation, tools that I could help this relative with. I told Andy today, this relative has graduated from college as a result of his guidance to me, which helped me in another crisis. Never saw me, never knew me before, called him on the phone, and that person is now going to be very successful, going to be on Broadway in New York, doing a lot of things that he would not have been able to do. This man, I owe him a lot of credit. So my thing is, I need you to tell me, there are a lot of professionals here, but not a lot of me, okay? How do you get more of me here? For example, where are the wallet-sized cards that have these organizations? You're saying about 27, but bulletin boards, libraries, I don't know that you all are here. I don't know how to access you. And what is the time frame to put in a call that you're going to walk me through in a minute for you all to decide who is the person that the family member or myself needs to reach out to? And then has law enforcement been equipped to work with you to diffuse and to know how to help myself and family members? And so I'm going to back up. I've got a crisis. What do I do? What's the first thing I do? It's a mental health crisis, okay?
Well, I
Just
work for the
scenario.
B.E.A.R team, so I'm going to say call the B.E.A.R team. And you can call.
And I don't know the
You can-
B.E.A.R team.
So you call 911 and they will connect you to the B.E.A.R team, or you can call 911 if you're in the county and they can connect you to M.I.H. We are 24 hours, and you can, so we do have a direct number as well, but you can call us and then we can help to navigate and do those warm handoffs and help with any access. So that's a resource, especially for the after hours and weekends. And I have flyers, and we can make sure that you have our direct number, because we don't just take referrals just from 911. We do encourage all providers and citizens to call us directly, and just the same, and you get the same level of service. And we will come out and assess or assist on the phone if you just have questions, whatever it is that you need, we can help.
So let me be clear. First, I call 911, then the decision is made where the call goes next, and then how long does all this take if I'm already in crisis and I need help?
Once you call 911, they usually get to within a minute or two. They have some standards too of where they have to transfer those calls, and our call comes directly to us, as in our phone's answered 24/7. So then you would get to the crisis counselor that's on duty for that moment.
Okay, thank you.
I can tell you for our mobile crisis, 911 can refer to us as well. And then we have to have a within 15-minute triage time. So from the time that you provide the information, whoever that is providing us the information, we have to call that person back, and either the client or whoever called them in, we have to call them back within 15 minutes and try to get some more information. And from that, we actually call it a mobile engagement safety plan. We will then figure out, okay, is there enough time for us to get to you? Do we need to look at other avenues to make sure that somebody gets to you as fast as possible? And that could also be law enforcement if they need to go out and have a safety check, or even come with us if we feel like it's needed. So for us, once we get the information, it's within 15 minutes.
I mean, I think that's going to be a challenge. We do try to do as many marketing events as we can. We had a billboard out. I know that many of the providers do different things to advertise our services. We have several resource fairs within the county. I think it's a lot of it is that word of mouth, and each season has its own. We have many different events that go in through the fair time, different times of the year. I think it would just be on us just to keep that marketing and making sure that we're advertising that, and those, if you know you're going to those, just to tell your friends, because everybody has a different avenue. I know that within the fire department and the B.E.A.R team, we use Instagram, we use Facebook, we use different, social media avenues, as I'm sure everybody here does as well. We do we really do try to reach out, especially if there is resource events and things like that, which are probably the most helpful, because that gets everybody in one spot, so that they can identify what their needs are.
And I will say too, one of the things that's been able to help us not just market what M.I.H does and a lot of these other services is through your hero, Andy. He actually does CIT, and so we engage in that training. So not only is it the law enforcement professionals, it's also every EMS professional. It's also security agencies, hospital securities, and other things like that come. Andy teaches de-escalation techniques, how to work with people with, mental illness, and how to work with people who are in substance use or have certain disabilities. So during a lot of that training, we engage with those individuals who work in law enforcement in other areas, and they learn about our services, so that whenever they are called to a crisis, because, let's be honest, sometimes when you call 911, you're in crisis and you may not be communicating exactly what you need, so they're going to send everybody. So if they send everybody, hopefully somebody on that scene will have met one of us and be like, hey, I know that person, I know who to call. So if nothing else, you're going to get a responder of some sort that has a little bit of education, thanks to Andy.
I have a question here, concern. Now, are there any type of satellite stations where people in the community can go get information? Because everything that we're talking about here, they have to come to you all, or would know to come to you all. And how would they know to come to you all if they don't have the information? in the community to go to say, hey, I got this out of the community, however they may get it, but wouldn't it make sense to have some type of a satellite station in the community, especially your poor communities where there's a lot of illnesses going on? People are mentally ill and don't know it because they're poor and dealing with a lot of mental issues. Where do they get help? They're not going to, when they started going through the issue, they happen to come to you all. But how would they know I need to go to a place where I might need to get a bed, or I might just have to get a temporary place if I don't have the information? So like you said, so when they come and you all come and you're sending everybody. So is there a plan or thought?
So that's a very good question. And what I will tell you is that we have 10 libraries, for one, across the county. And we do have information at all of those libraries because a lot of people go to those libraries and they're located in all of those communities, right? And so we do have a lot of information, a lot of pamphlets, a lot of resources in those libraries. Jose is standing here. He's one of our peer support specialists that visits all of those libraries and is very active giving that information out. He works with all the different demographics, and he's out there actively putting that information out, talking with individuals, hosting different kinds of events, different types of trainings. And so we try to meet people in the community because not everybody can make it here, or not everybody knows to come here. So we do try to do that, as well as lots of outreach in the community, whether it's at a barbershop, at churches, at different types of community events. So we do try to go out into the community and provide resources, but we also rely a lot on our community partners and on you guys, just citizens, right? And getting that information out to us as well. But if you have suggestions, definitely reach out to us. We're happy to partner with you as well. If you want to welcome us into some place that you know or some space, we'd love to do resource cafes and different things like that where we can get out in the community and help spread that word.
Hi, my name is Carlette McDonald, and I'm a school social worker. So I would like to invite you guys to come to the school system. We need to hear about these resources. We're familiar with B.E.A.R, excuse me, but we have dealt with a lot of kids who have had serious issues and sent families to Brenner, and the kids will be checked out, and then they will receive a referral, which could be 3 to 4 months out, and that family needs help like right then. So I would love to see you guys come over to Forsyth County School System, district office, or the social worker department. We need to know more about you guys and how you can help us. It's sad what we're seeing our kids deal with. We had a meeting Tuesday. We are already preparing ourselves for Wednesday because we know what's coming. We need your help.
All right, thank you. Yeah, and we just recently, Wanda Kellyman, I don't know if you're familiar with her, she went to graduate school with me. They're here tonight, Winston-Salem and Forsyth County Schools, so we're always looking to partner with all of our community partners, so definitely keep that in mind, get with us, and that's for anybody that's here tonight, and anybody that you know, keep spreading the word. We're really excited to have been here tonight with you at the Town Hall, and definitely engage with us. Find us on our socials. Find my information, again, Michael Duncan, Behavioral Health Services Director. Anybody that's up here, I know we're here because we care about you, we care about the community. So reach out to any of us. That's why we wanted to do this tonight. Everybody up here wanted to be here to really spread the word about what we do. We don't have all the answers, and like I said, we're just 4 of the different community partners. There's many more out there, many in the audience here tonight, but we appreciate you being here. If you have further questions, you can definitely reach out to any of us. I know any of us are happy to continue this conversation. Again, we appreciate our county officials being here, commissioners, county managers. We appreciate you being here. Thank you.